it is my privilege to introduce our esteemed keynote speaker, Dr. Jasleen Chhatwal, who will set the stage for an engaging and thought-provoking journey ahead of presenting on the topic, Becoming a Change Agent, Advocacy in Action. Dr. Jasleen Chhatwal is an Arizona physician, board certified in psychiatry, addiction medicine, and integrative medicine. She currently serves as Chief Medical Officer at Sierra Tucson, a residential mental health treatment center, Behavioral Health Medical Director with Blue Cross Blue Shield Arizona Health Choice, and is an assistant professor at the University of Arizona College of Medicine. She's active in advocating for her patients, colleagues, and profession through elected and appointed positions with the Arizona Psychiatric Society, Arizona Medical Association, and American Psychiatric Association. Echoing naturalistic healing disciplines, Dr. Chhatwal believes that the human body has the inherent capacity to heal itself when providing with a nurturing environment for the mind, body, and spirit. In her practice, she collaborates with colleagues from various disciplines, aiming to recreate that nurturing environment so individuals can start their journey towards a healthier, more wholesome life. With that, I will now turn the stage to Dr. Chhatwal.
Thank you so much, Rizvana, and thank you everybody for being here. I usually like to, say that time is our most precious commodity. So the fact that you're sharing your time with me this morning and with the rest of us, we're really honored. So thank you for being here. Thank you for the very kind introduction, Rizvana. We'll be talking today about how to really get engaged in advocating for the things that we're so passionate about. And really, all of you are here and spending the whole day in this conference because this topic is important to you. The patients, the individuals, the populations that we're talking about have deep meaning for you, and you may have committed your educational career or maybe your entire career and life to this. And so I hope that what we take away from today's session is just ways that you can convert that passion, interest that you have into actions that actually change the community around you and help make the world a better place. I do not have any relevant financial disclosures to this presentation. I don't get paid for being a lobbyist or doing any of that work. I do obviously get a salary from the couple roles that I had listed on the slide prior to this, but those are not advocacy roles per se. In terms of our learning objectives, I will be describing advocacy and we'll be reviewing about 4 different methods for advocacy and maybe a few more peppered in. We'll distinguish between advocacy and lobbying because sometimes people's employers or their place that they're affiliated with organizations will tell them, oh, you can't lobby, or they hear a lot about lobbying. And so we want to describe and distinguish what those are, as well as look at scenarios where you might use each. And finally, we'll discuss steps to creating effective partnerships with other community organizations, subject matter experts, regulators, and legislators. So a little bit about myself. And when Rizvana reached out about this presentation through Dr. Emmerich, I wondered to myself, I'm like, why would I be a keynote on advocacy? Like, who am I? Why would I be talking about this topic? And part of that questioning comes up for me because I've only lived in the US the last less than 13 years. So I'm very new to this country in some ways. But the other thing also is that I was born and raised in India, and India's political and regulatory system is very, very different than the US. So in some ways, when you think, oh my gosh, legislative advocacy or advocating for anybody, that sounds so hard. It sounds so foreign. It literally was foreign to me. So when you start thinking about how hard it is and could I really do it, I hope that today you'll remember that. It was so very foreign to me. I did not understand the political system here. We do not have the same kind of state and federal separation that is present in the US. We don't have this type of legislative system. We're very much still like the UK is. We have a prime minister and a president in India. And so all of this was very new. And so the message that I want you to take is that if I can learn this gradually over time, I'm really hoping you can too. So advocacy versus lobbying. And I would love to hear from anybody in the chat if you had any sort of negative or positive association with either word. Typically, I see people having like a positive association with advocacy, but somehow a negative association with lobbying. But let's define what these are. So advocacy is really just building and nurturing relationships, typically with people who are decision makers. So, you know, it oftentimes ends up being elected officials and their staff members. It may also be you building relationships with people who are regulators or in other positions of influence within your own organization, because you could also be advocating within your own organization or within your community. It could be with any really person who has decision-making capacity. But when we look at elected officials, you're trying to build that relationship to help them better understand what you do and how you do it. So it's a good thing to try and invite them to your healthcare setting. That way they know what you do and they can actually see the ways you're having impact. You want to introduce them to your staff or other colleagues that you have, as well as people who are utilizing the services you're providing. And you want to always try and maintain contact, share data, share personal stories. So that's really all advocacy is. Advocacy is making a connection and finding a way to sustain that connection, as well as make your passion and your interest relevant to people who have decision-making authority. Sometimes even when you're in a certain class in college or you're doing a university course, when you go to your mentor or your preceptor and you tell them about some struggles that you're having and you're asking them to make a change for you, that is also advocacy, right? At a very basic level, that's more for a personal or professional level of advocacy. And we're just taking that to a higher level. And lobbying literally is just making your ask. So whenever you ask somebody to support or oppose a certain action, that is what lobbying is. So from a legislative lobbying perspective, when we ask anybody to either support or oppose a certain legislation or a decision that's being made, that essentially is lobbying. When we think about lobbyists who do this work day to day, they're often doing this as a paid role, and they're working with elected officials to either introduce legislation or influence it. And then they can also do other things to build support, such as having an advocacy day. So I know, like for maternal mental health, we have a day in May usually. And so that for us in some ways is a lobbying day, because we're going there and saying, you know, we really want you to support this mission. But on the other hand, it's also advocacy, because you're just educating them on the importance of maternal health or maternal mental health or whatever the topic is that you're going for that day. So the way my journey started for advocacy is that I've always been very passionate. As a child, I was the person who was up in arms about everything in my house. My mom got really sick of me because I would, you know, have needs and wants, and I was very persistent and constantly there to highlight how maybe I was being wronged in the house. I needed certain rights. A story comes to mind when I think I was 10 years old or so. My parents got an air conditioner in their room. So they had a window AC unit. And it was the first time we'd had an AC in our house. And I remember going into their room and saying, oh, well, you know, your room's very cool. And my room had a fan and a little cooler unit with water running through it to make the room cooler. And they said, oh, yeah, you can come sleep here. And I'm like, no, my nanny's in the other room. So, you know, I'm not going to leave her alone. I'm just going to sleep there. But then I would constantly lobby my parents to try and see if they would let the nanny and I sleep in their room together. to the point that after about a year or so, they're like, you know what, we're going to put our savings together and try and get you a smaller window AC unit too. So I feel like that was my very first successful lobbying effort where I was lobbying my parents for this. But when I came to the US, I started to realize that me not knowing how the system worked was really something that was hampering my ability to make changes in the ways that I wanted to make in mental health care. So I'm a psychiatrist by training. I had actually come to train in the US thinking that the US healthcare system being so well resourced would be something that I would just be able to step into and do excellent care. And I know today that I was naive. And so as I was training at the University of Arizona here in Tucson, I started realizing that I was feeling very frustrated at times with my inability to provide the kind of care I wanted to patients because of social determinants of health that were impacting them, their social needs, their inability sometimes to have health care. That was a little bit before the Medicaid expansion actually took place in Arizona. So there were a lot of patients who were uncovered and were uninsured that we were seeing. And that's when I started to look for organizations that would help me better learn about the system. So there's obviously Google, where you Google search and you try to learn about a certain topic. But then I discovered an organization in our state called the Arizona Psychiatric Society. And that's meaningful to me as a psychiatrist because it was other psychiatrists who maybe were facing similar issues to me. So I would ask you to think about organizations that would align with what you're interested in. I started joining the Arizona Psychiatric Society meetings, and some of the stuff they would talk about would just go right over my head because we were also in the days of conference calls at the time. So I couldn't see people or hear, I would just hear what they were saying and try and understand the topic. But really 2 or 3 years of doing that, I started to at least understand what they were talking about. And then very quickly, as I moved into my own practice and started being able to be more fully engaged with those issues after I had completed my training, that I started to want to find more ways to be engaged. And so I discovered the Arizona Medical Association's Doctor of the Day program. This was a way that the Arizona Medical Association allows those of us who are physicians to go to the Arizona legislature and meet with our legislators. We're also volunteering as sort of the on-call physician of the day. And I know that there's many other organizations that even though they might not have something that's as formalized, they do have many ways that you can go and connect with your legislators. Often your guild or professional organizations, or even your school will have a lobbyist who you can connect with about a topic that you're very passionate about. And they're often very helpful in helping you have meetings with legislators who represent you or legislators who cover a certain issue. And so as part of this meeting in March 2020, before the world shut down, we were trying to pass a bill on mental health parity. And so I got to meet the governor's health policy person, Christina Corrieri at the time, who was working with Governor Ducey, as well as my legislator at the time, Representative Alma Hernandez, who's in that peach dress there. And both those relationships that I built on that one day of visiting became really important to my own learning of advocacy. Representative Hernandez was so helpful. She actually was like, oh yeah, just message me on Instagram anytime. And she gave me her cell phone number. And so it was great to be able to connect with a legislator in that way. And I felt at the time when she gave me her cell phone number, I'm like, I'm never going to reach out to her. Like, who's going to just text their legislator? And 2 weeks later, there was a mental health bill that I had spoken to her about. And when it actually went up for a vote, I had her text me to ask me what my position on the bill was. I feel like that was that one moment sitting in the parking lot at work at 5 p.m. when I got that text that hooked me into realizing how much influence we have as people who are subject matter experts in the areas that we're working in. You don't need to go get a policy degree. You don't need to have done a master's in public health. Really just doing the work that you do day by day is what makes you the expert in that area. And that's what legislators are needing from us, because most of them come from different backgrounds. Somebody's coming from a construction background, somebody's run a grocery store, another person is a nurse. None of them have the full breadth of experience that is needed to make helpful legislation for Arizona, right? Nobody can have that much knowledge. They do have analysts that help them, but most legislators rely on people like you and me to be able to give them their opinion and share their perspective. And so going back to that difference between advocacy and lobbying, advocacy is nonpartisan. You're just going out as a subject matter expert. You're saying, this is the reason this thing is good to do, right? So when we start talking about working, say my area of mental health, we were working on mental health parity, which is treating mental health equivalent to physical health. I don't need to say you need to pass a bill or you need to do this other thing. I can just go and say, you know, mental health is not treated at an equal footing as physical health. And I think it's really important because when it's not treated at the same footing, these are all the negative impacts I see to my patients. And these are the impacts that we're having on our communities. So advocacy itself builds a platform for lobbying if you want to lobby or influence a certain bill. But on the other hand, just building that relationship and being able to share your opinion might be good enough. Because if Dr. BVG went and spoke to somebody about maternal and child health, and then 2 or 3 weeks later, or sometimes even a year later, the topic comes up, her legislator might reach out to her and say, hey, I remember you were telling me something about this. Are you an expert in this area? I'm dealing with this bill. Can you share a little bit more with me? And so that might be a way that without really even going in the lobbying realm or following bills or doing any of that, that you can start to have an impact using the knowledge you already have. There's various things we can do in advocacy. We can educate decision makers just kind of at baseline. We can provide testimony, which can be written or oral, and we'll cover that a little bit. You could also help with simple things like voter registration, which is so important, that's just giving a voice to other people. There can also be community education. There's town halls, there's events where you can go talk to your community about what you think is really important. And then finally, also things like candidate forums or town halls that different legislators or groups might do. I think one of the first places where I provided testimony was at my workplace. There was a town hall about Medicaid expansion, and there used to be this able-bodied clause. And I remember being so nervous. I'd written down some notes, and my voice was shaking as I raised my hand and started to talk. And sometimes that still happens to me. Like I start talking and I'm like, oh my gosh, why am I doing this? Why did I put myself in this situation? And like I'll feel my face flushing a little bit. But it's one of those things where something that is so important to me, I feel like we should then be it's okay to be a little uncomfortable. It is a growth curve where we're doing that. And then again, going back to lobbying, it's an attempt to influence legislation. You can do it directly. So this is actually emailing or reaching out to your legislator or your government agency to say, this is what my position is. These are the reasons. I really hope that you will vote in or, take a stance in the way that I'm asking you to. There can also be grass tops lobbying, which is asking people who are influential in your community or people that who might have a connection or influence to contact legislators. And then finally, grassroots, which is happening in the state with the reproductive rights ballot that is trying to be put on the November ballots. So that's really a grassroots effort where there's citizens who share a common goal who are trying to build momentum so as to get that work done. The big thing about advocacy and lobbying, since the world is such a divided place, I felt like I needed to put a slide specifically for this. You definitely still always need to be polite, right? We need so much more kindness in the world. And part of those golden rules when you're advocating or lobbying is always to be polite, always to be professional, don't lose your cool, even if the person who you're talking to seems totally disinterested or on the exact opposite side of the issue that you are. I found myself in that place many times where internally one can feel like, oh gosh, I'm seething about this, but you still are really trying to keep your cool. And if you really feel like it's a topic where you may not be able to, then that might not be the person that you want to go advocate with. And you really want to pick how much you can manage at the time, because self-care is very important in advocacy. We don't want to make it so that it's really wearing us down, because sustainable advocacy is what is needed right now. And you want to be prepared, you want to continue to be persistent and really stick to your message. Some of the ways that we try to encourage people to build these relationships is go ahead and reach out and figure out who are the people in your environment who share the same passion, the same expertise as you. So like for myself, I found the Psychiatric Society, the Psychiatric Association nationally to be places where I may go settle, also the Medical Association, and I'll share about another organization or collaborative that now I'm a part of, which works with professional well-being. So those are some of the areas that I'm very interested and passionate about. And then we've had coalitions that we've built for certain things when we're passing or trying to influence change in certain areas. Like last year, we worked with a few groups across the state to influence a bill around collaborative care, which is the collaborative care model for mental health. And so you can have these networks where you're really connecting with people around common missions. After that, you want to connect with legislators or regulators, the people you want to influence. Always make sure that you're sharing your story. Because again, you might not remember all the other facts and figures somebody tells you, but stories are what connect with human beings. So really sharing why you're passionate about it, how you came to be there, because as much as white papers are encouraged in academics, white papers don't often get read by legislators as easily, right? They're helpful to have in the cachet, but you still want to be able to share your story. And always persistently follow up. The first time you meet somebody, it's like trying to build a friendship. The first time you meet somebody, you might be like, oh, that person's cool, but you're really not going to become friends with them. And so similarly here, because you're trying to build trust with your legislators and influential people, you're trying to continue to show up in front of them. So for myself, I do that Doctor of the Day program every single year. Whenever there's an opportunity to go to the legislature, to go talk about a certain issue, if I am available, I will try my best to go, because familiarity is really what is needed in some ways. And last year I was at the legislature so much that after a while I had few legislators joke with me. They're like, hey, Jasleen, do you want an apartment in Phoenix? Are you going to start staying here? Because I was driving up from Tucson almost weekly at one point. And then continue to make periodic outreach, right? Even when the issue that you were really passionate about is done and gone, you still want to let them know that you appreciate the work that they're doing. Being a politician can sometimes be sort of a thankless job as well. Now I want you to take a few minutes to try and at least find your Arizona legislators. So you'll go to that website, azleg.gov /find my legislator / and take some time to pull up what your legislative district is if you don't already know it. So when you go to that page, it'll say if you know your representatives, click here. The second option will say if you don't know your legislative district, go ahead and click, and then it asks you for your zip code or your full address, and you can get your legislative district. And then we'll come back and look up who your legislator is. I've also put links to find out who your House and Senate representatives are federally, so in DC. And then there's another website, which is usa.gov /elected officials. It's a little imperfect when it comes to more state type representatives, but both of them, all of these websites are good to have. And I think especially knowing at least the people who represent you in your local community, so your city council, etc., and then state can be a good place to start. And maybe when you're able to look up your district, you can let me know. Maybe raise your hand that you're done looking it up, or you can put it in the chat, and I'm trying to monitor both. And I want you to do that right now because whenever I talk to people and they say, oh yeah, we're gonna look it up once the session is done, you're not going to have the time to do it because you'll move on to the next thing. And I would encourage all of you, once you find your legislative district and then can go to the list of legislators and see who your legislator is. Okay, Christy's sharing, she's an LD 27, great. So once you find your legislators, you'll see that their email addresses are listed on that website. And that can be one way to start reaching out about a topic that's important to you. And it can just be a way to say, hi, I'm Jasleen. I'm a psychiatrist in your area. You're my representative. I'm really learning to talk more about my interest around mental health. And I have I would love to meet with you when you're back in the district and have some time. And right now, the legislature is actually off till next Wednesday. So it could be a time to say, I'd love to meet with you for a coffee or come meet you at your office and just discuss my interest in something that's one higher end way. A lower path might be to say, I'm so and so, this is my interest. I just wanted to share this with you. This is my contact information. If you ever need more information on that topic, I'd really be happy to serve as a resource. And my tip in this case is don't just email them, because like all of us, they get a gazillion emails as well. And you always want to CC their staff member on there, because their staff member will be the one who will alert them. Wonderful. So it seems like quite a few people are looking up their district. Thank you. Awesome. Well, great. So one of the other things that we can start to do, like I was sharing, is, as much as we can do some of this individually, and it's great to be able to do that, really building support for the things that we're interested in can be important. So coalitions can serve that function, and they can be called stakeholder groups or coalitions. And these are other organizations, other special interest groups who share a common mission. When it comes to things like mental health, we start to reach out to all the other mental health professions. We reach out to different academic centers who may have an interest in talking about or sharing that. We reach out to hospital systems. And so you can start to build a stakeholder group where you say, hey, we're working on XYZ issue. Is this something that you'd be interested in collaborating on? And many different people will join your group, and you can see based on their bandwidth or interest on that topic how much collaboration you get. I usually recommend that we get very clear on common goals and objectives, because sometimes in stakeholder groups or coalitions, when those fall apart is when different people in the group start pulling in different directions. And recently there were a couple of bills where I actually heard from legislators where they were like, well, this group was very passionate about it, but now 3 of them in that group are asking me to go in a different direction. And that can really dilute your message, right? If you're asking the same person to go in a few different directions. So when you're building coalitions, getting very clear, maybe even writing up a charter and saying what are our 2 or 3 top objectives would be helpful. And then in the coalition, starting to invite subject matter experts who can teach you and talk more about the issue, both from a policy standpoint, also inviting lobbyists who are subject matter experts on understanding the legislators or the regulators who are the audience and asking them, hey, what are their leanings? What would be the angle of this issue that they would be most interested in? One of the things that we did recently, so I was talking about the Wellbeing Collaborative. This is a recently put together coalition. It started in about 2020, 2021. A lot of different organizations are part of this Wellbeing Collaborative of Arizona health professionals. And I actually got invited to it pretty late, so I wasn't part of the starting group. But it was a starting group of health professionals in northern and central Arizona who started talking about how difficult it was during the pandemic to be a health professional. And so they started saying, what can we do to support each other? And what just started as a casual conversation has built now into a nonprofit that held a virtual an in-person conference just last year in the fall. And then earlier this year, as we were launching further into our third full year of functioning as an organization, myself and another family doctor were actually leading their legislative arm. And as part of leading their legislative group, we decided that we would try and work with legislators in about early March to declare a Health Force Wellbeing Day. And so it was something fairly simple. It's sort of like an advocacy day, but we really wanted to make sure that there was a day that was recognized, and that is going to be our point of starting to educate legislators even further about health professional well-being, because we've been trying to do that as part of other groups, but now we're really taking a more focused approach. And as you can see on the screen, we have a lot of different other groups that signed on to just this effort for the Workforce Wellness Day, but that we're also, if you go visit our website at the Wellbeing Collaborative, there's various hospital groups, there's insurers, there's medical and nursing organizations. There's just a whole lot of people who are helping with it. And ASU actually has been a powerhouse of support for us as well. And so these are just ways that organically some of these movements can grow. In terms of the coalition, again, when you're building a coalition or starting a process towards advocacy, you are also needing to build your narrative, right? Why is this important? So if we don't have a clear why, then we cannot motivate other people along with our mission. And the three big ways to build your narrative is storytelling. And I know I've come back to it like the sixth time already, but storytelling is the most impactful way that you will be able to influence change. You can add statistics, and statistics are important because they give sort of the reason of what is going to be the impact. And it becomes very important to highlight the impact in this community. So the community that is being served that we're talking about, which is why talking about Arizona, or if you're talking about Maricopa County or Pima County, Pinal County, Coconino County, wherever you are, you want to start really highlighting how what you're asking for, the topic that you're interested in, impacts the community that you're talking about. And then finally, showing the societal impact that the change that you're requesting will have. How will it change the lives of the people who live in Arizona? So starting to really identify those three elements and weaving them in becomes an important component of however you do advocacy. There are also people who, might think that they're find it easier to write. And so using things like op-eds, which you can share in newspapers, or you could write a letter to the editor. That can be some ways of highlighting an issue, but also writing letters to your legislators. So like we said, we've identified their email. We're going to CC their staff member always when we're writing these letters of support. But then we can write letters that say, these are the reasons I'm really passionate about this issue, and I would like you to, meet with me or talk with me. And if there's actually a bill or another type of influential event that's happening in your community that you can ask them to participate and such. Always do your homework, practice and hone your message. You want to practice to really get clear on what you're asking for. And it's good to meet with somebody else who does some of this work or works in the political lobbying space to try and understand what is realistic. So earlier this year, or even currently, we know that Arizona's budget is not doing so well. So we were in the red right now. And so asking the legislature to do anything that will require to spend a lot of money can become a little bit harder. So when we're looking at bills or we're looking at things we're asking for, we're always seeing, okay, well, what are we asking for? What's the cost? And in some ways, I wouldn't know that because I don't stay at the legislature. But my lobbyists that I worked with did know the issues around Arizona's budget. And so I said, okay, well, if we want to get something done, maybe we don't say, please sponsor this for 10 years. We say, can we do a pilot project or can we do a small study and can you support that? And so those are some ways that as you start getting into more granular advocacy, that you may want to learn those pieces. But if this is something you're just starting with, even being able to say, I'm really passionate about this topic, these are all the ways it has influence is a good way to start your messaging. And then finally, if you are asking for something, make sure you're being very clear. I want you to support this, or I want you to oppose this. That is one of those things where you might put that in the subject line, or you might end your email to a person, or if you're meeting them in person, then you'll say, I really want you to oppose Bill HB XYZ, whatever the number of the bill is, because you don't want to leave any ambivalence around what you're asking for. And then the final other way that we haven't talked about a whole lot right now is that you can also just work with government and regulatory agencies to change rules. Not everything that we do needs to happen through legislative route. So oftentimes when we're talking in groups, people are like, oh, we're gonna have to pass a bill. And sometimes passing bills means nothing, because if you pass the bill and the rules cannot be created or it gets stuck in what is called rulemaking, then it actually doesn't get enforced. So there can be some bills that get passed and don't really have an impact at all. And then there's other things that keep on coming up for revision or review through regulatory agencies. And you could just completely bypass the legislative process and enter in through that rulemaking or review process to give your opinion and ask for change. And I'll share a little story about that. So one of the ways that I got involved in regulatory advocacy was that when I became the president of the Arizona Psychiatric Society, also in 2020, which was, I guess, a big year for many reasons, one of my big goals was to improve physician mental health. I had been serving as a peer and peer support for other physicians, so where we were providing telephonic support to physicians in Arizona who were struggling with any kind of personal, social issues. So not functioning as a psychiatrist, but just being supportive as a peer support. And started to learn that there were people who were physicians who I thought should go see a therapist or maybe go get a psychiatrist. And they would say, no, I'll just talk to you a little bit more. I'm fine. And I was realizing that they were really scared that somehow the board, the medical board, would have a negative impact on their licensure. And so it was one of my big goals. I was like, I want to do something about it. So I had started talking to some legislators about making changes. But as I was trying to discover what the way would be, I suddenly realized that the medical board had its health application, sort of its licensing application, up for review. And it's just up for review every 5 years. Lucky me, the 5 years happened to be then. And it was 2 weeks, the day I discovered it, there were less than 2 weeks for that comment period to close. So I very quickly jumped into action. I reached out to my people at the Psychiatric Society, reached out to the Medical Association, And I said, oh my God, this is a thing I really have wanted to do. I've been speaking with you guys about it. It seems like it's up for review. Can we submit comments? And in under 2 weeks, we were able to get these many organizations, so that's 20 organizations on your screen, to be able to sign on to a letter, one letter that I wrote. So with the help of some other colleagues, we put together all this data, and with help from our American Psychiatric Association, wrote a letter, had 20 organizations sign on, and submitted it to the medical board. And then it took a year of them going through their review, inviting me to come talk to them, I think 2 or 3 times. And then finally through that process, by March, by I think March 2022 or February 2022, the application actually got changed. And really at the start of that was that one letter which I was able to write and then have other people sign on to get our licensure application changed. So previously our application used to ask us if we had ever had any mental, emotional, or psychiatric health issues, and we would have to sort of share a little bit. And it was very ambivalent about whether it was saying you needed to share all your health history or only if you were impaired. And we were able to change it to actually remove those questions. And our hope is that over time, that would mean that physicians can seek mental health care more easily. And so those are sort of simple ways that you can do that. Preparing testimony is a hard thing to do. And like I said, you know, that's the thing that makes you nervous when you're reading it and your hands shake. But really, it goes back to all the things that we've talked about. Know your audience, know the group that you're talking to, research their policy and political leanings, highlight what you think is important to the people you're talking to. And then for written testimony, same things about knowing your audience, but you definitely want to bold the main points. So underline and bold things that you really think they should highlight, they should pay attention to, add graphs, make sure it's courteous. Let's not make personal attacks on anybody, and really keep it very professional, but then also use your voice for it. Providing testimony is sort of like you're at level 4 out of 5 by that time in your advocacy journey. But providing testimony can feel very challenging because you're in front of a group of people and there's people in the audience often behind you. But again, the same principles apply. Practice your message. Make sure you know how much time your testimony is taking. Make sure you, again, know your audience, what the opposing side's message would be. And you can, prior to giving testimony, email the people that you're going to be speaking in front of to let them know some of the information that you'll be covering so that they have it in written form as well. And then in Arizona, there's a system called the right to speak. That is what we typically use if we're trying to speak in front of the legislative committees. And I've put in instructions on how you can sign up for that. But even when it comes to town halls, those are places where you can just show up. But like the medical board or other boards, other regulatory agencies usually have to sign up to say, I'd like to speak. And when they put out their public facing message saying that they're going to be taking testimony, they'll always have a link for you to sign up to say that you'll be speaking. This is instructions to the Arizona's request to speak. These should be in your handouts that you'll probably get from the conference, and I'll have my information at the end so you can email me if you need it. But this is just a cheat sheet on how to sign up for Arizona's request to speak. And this might be task 2 to take away from today, that might be a good thing to do, to just sign up so that you can start to look at that. And this is, again, just step by step. So you'll have that in your handout, and we won't be doing that now. And this is a picture of me giving testimony to an ad hoc committee around trans health. This was, I think, in 2021 sometime. And it was one of those times where I was very nervous because I don't consider myself an expert in trans health, but I was asked to come give testimony by a legislator that I really respect. And I said, why don't I get you somebody else who's more of an expert? And he said, no, you're the president of the society. I want you to testify. So I remember sitting in a Phoenix hotel room the night before and furiously writing and rewriting my testimony because I was so nervous about the group that I was speaking in front of. And I knew that it was a topic that could be very inflammatory for some people, and really trying to see how to hit the right tone on highlighting all the problems with the way the legislature was wanting to handle that issue, and still staying true to who I am and what I believe in and what the science is. So always have somebody that you can rely on and somebody that you trust to look through your testimony. So some tips to providing testimony. If you don't know Robert's Rules of Order, it's just good to go watch testimony for some time. So if you're going to be presenting to a committee, go there an hour before, see how they're talking to each other, because there's a very specific etiquette of always acknowledging the person who's leading the committee. So you say, Madam Chairperson and committee, or you might have a different way where you might say Senator so-and-so or Representative so-and-so, but they usually will have a very specific etiquette, and you want to sit there and watch and learn about that. And then stay on topic, take your time. The reason I was saying you need to practice your testimony is that typically you'll have a 2 or a 3 or a 5-minute limit. Those are like the cutoffs. And sometimes it is that most committees will have 5-minute limits, but then when they have a lot of bills to hear, they'll just say you only have 2 minutes. And so you need to sometimes have different versions of your testimony that you'll read. You'll say, okay, this is my 5-minute one. And then if they suddenly give you lesser time, what are the topics that you will highlight if you only have 2 minutes? And then if they ask you questions, which you always want to invite, you say, I'm open to questions, any questions you have about my testimony. When they start asking you questions, if you don't know them, never, never, never make up things right there. It's totally okay to say, I don't know the answer to that, or I don't have that information right now, and I'm happy to get it for you. And then because you said I'll follow up with you, you want to follow up. You want to summarize, and it's another time to highlight how or what you're asking for, thank them for their time, and then always share your contact. I'm the person who just sends out my cell phone number and my email, but whatever you're comfortable with, and especially given the person that you're working with or trying to testify in front of, you want to make sure that it's some way that you'll definitely get the information if they send it and you'll respond to it. Another thing that I've started to recently get involved is doing fundraisers, or starting to also invite people to come talk to my friends and colleagues, and people who are interested in a common topic. So here I had ex-Representative Daniel Hernandez, who represented a part of Tucson, come and talk to a group of my colleagues around mental health. Recently, I've also had a couple of the legislators come and talk to my class. So when I'm teaching at the University of Arizona psychiatry residence, we were talking about advocacy. So I invited 2 legislators to come talk to my class about how to do advocacy and really share with them their expertise. These are some of the bills and issues that I've personally been working on the last many years. And I think, each year I try to pick like one big issue that I'm going to focus on, because I also know you can only do so much at one time. And for me, there's other topics that I'm very, very interested in and would want to continue doing work, but also know that I can't be the one to do it all. So when there's other topics that come up, we try to divvy it up between colleagues and say, okay, can you run point on this issue and I'll run point on this other, and then we can still collaborate in the background on highlighting different topics and such. So I'll leave you with this quote: medicine is a social science and politics is nothing but medicine on a large scale. And even though it talks about medicine, some of you are in social sciences, so that's really sort of your arena. But even if you're in any form of healthcare, any kind of work, if we don't stay involved in our legislative process as well as our communities, then we really can't expect our communities to be any different. And for me, I always feel like advocacy is a big part of an antidote to my frustration. And there's a lot of very excellent papers out there that say that people who actually stay engaged in organizations, have communities with which they can work on changing things, they actually feel less burnout, are more motivated, are able to do their work in a more sustainable fashion. And so really being able to have your voice heard is a very, very important thing. Making sure that we know that we have a voice and that it deserves to be heard is a very validating experience. That doesn't mean that every time I've spoken up or tried to do something, I've been successful. In that list of wins, I could have doubled up the list of things that I did not think went well or went my way. But I try to focus on the wins because that's what helps make this sustainable. And to know that, not everything will go our way, but we really have to be engaged and involved in the process to make a difference. And thank you so much for being with me today.